In doctors' offices, it used to be a familiar sight, row upon row of patient files. Over the last decade, more and more practitioners have been switching over to electronic systems. One system was created right here in Prince George by the man who's now Northern Health's Chief Medical Information Officer.
So I understand.
Before even starting an exam, Helen Burke already knows what she's looking for.
I can quickly press a couple of buttons and get a really good idea of what's wrong with my patient. So I can, for instance, press Alt-P and I know all of their problem list. I can check their medication list, their long-term medication list. And so without even meeting them yet, I already have a good idea of what's going on with the patient.
Whether it's medical imaging, prescriptions, or ER visits, a patient's info is stored in her computer.
Everything is here, so at a quick glance, you have a really good idea of what's going on with the patient. So it's a really fantastic tool to use every day in primary health care.
Over the last 5 to 10 years, electronic medical records have become more and more popular. Dr. William Clifford was far ahead of the trend.
Painfully obvious that these kinds of facilities were missing in healthcare.
When he was a family doctor back in 1990, he created his own system.
Started out with the basics like billing so I could get paid, but very quickly escalated that into the area of doing clinical documentation, clinical decision support.
His Medical Office Information System, or MOIS, allowed doctors to better keep track of chronic conditions and medications.
When you could do really cool things like being able to, when there was a drug advisory, to say that a certain drug in combination with another certain drug were a dangerous combo, to be able to find that in about 30 seconds, all the patients in your practice on that combination, phone them individually and rebook their appointments without even getting up from your desk, all in the period of about 15 minutes.
There were some other systems on the market, but none with as many features to protect patient information.
When you look under the hood and you realize that, hey, where's the antivirus, where's the authentication, where's the centralized management of all these things, it's not all that common.
I think the public would be surprised at how much of our system today is driven on electronic medical records.
The system is used across Northern Health.
Well, it means I can see a few people maybe a little bit faster because I have a quick way of doing this. I still have to do all my typing for my own notes, but it really gives me a fast way of seeing what's going on with the patient before going from room to room.
That's exactly what Dr. Clifford had hoped, improving patient care through technology. Camille McDonald, CKPG News.